As massage progresses to a new location, in this case the leg, using drag palpation is an effective way to assess for temperature changes and changes in the skin texture. To facilitate body mechanics, it is helpful if the massage therapist kneels to apply a different angle of force. Compressive force with gliding effectively addresses the hamstrings. Active release can be introduced by applying a compressive force and having the client move the tissues back and forth. The attachments of the muscles around the knee are important to address. The knee can be internally and externally rotated to assess for joint play and efficient movement. If an area of restriction is found, indirect functional techniques are a beneficial way to treat the tissues. It is very important that the calf is assessed to make sure that the gastrocnemius efficiently slides over the soleus. If an area of bind is identified, shear force and bending forces are used to reduce the adhesion. Other areas where this commonly occurs are the pectoralis major, adhering to the pectoralis minor, and the rectus femoris, which adheres to the underlying intermedialis. The medial leg is best massaged with the client in the side lying position. The tissues can be assessed using a gentle shaking method. Various forms of compression spread the tissues, reducing the tendency for the muscles to adhere. Drag palpation can be used to identify potential trigger point activity. The skin will also bind over areas of active trigger points. All of these assessment methods are much easier for the client to tolerate than compressive force palpation to identify trigger point activity. The trigger point can be addressed using a slow, gliding compressive force. The hamstrings respond very well to being shaken. By positioning the leg as shown, the muscles are placed in a passive position and are more easily addressed. Compression that moves from proximal to distal encourages arterial circulation. Again, addressing the trigger point that was previously identified, compression is applied and the client is moving the area back and forth. This introduces both post-isometric relaxation and reciprocal inhibition. The area is reassessed. If the trigger point remains, direct ischemic pressure can be used to deactivate the trigger point. The area housing the trigger point is stretched using direct methods. If assessment has indicated that the hamstring attachments and the adductor attachments should be treated, this is the time to most efficiently apply the release method. In this example, inhibitory pressure is applied to the proximal attachments and the client moves their leg up and down to activate the muscle. Athletes often have increased muscle density or increased muscle tone due to fluid retention. This is very common in the calves. Once the area has been assessed, lymphatic drain methods can be used to reduce the fluid pressure. Once the fluid has moved, then increased compressive force can be used to address the muscles. Bending the leg, as shown, allows the gastrocnemius to effectively be moved away from the underlying soleus. The muscle mass is also easily shaken in this position. The lateral leg is best addressed in the side-lying position. The iliotibial band often becomes short and tight in the athlete. Drag palpation and skin movement into ease and bind identifies if areas of tissue pliability are lost. Connective tissue methods, including tension force, bending, and kneading, can be used to soften the tissues in this area. Athletes are prone to fluid retention, especially after heavy bouts of exercise. Increased fluid retention is a component of delayed onset muscle soreness. This fluid retention responds to lymphatic drain measures. Once the fluid has been moved, then the deeper muscle tissues can be addressed. The iliotibial band responds to various forms of connective tissue stretching. The most efficient method for increasing pliability in this structure is kneading. Do not use compressive force over the iliotibial band. Bending, shear, and torsion forces are much more effective. It is helpful to roll the entire tissue mass of the thigh around the femur, and the area can be finished by shaking. Athletes are prone to ankle injuries. Often, when the ankle is sprained, the fibula bone becomes displaced. By palpating the head of the fibula and moving the ankle around, any areas of bind can be identified and then addressed with massage. Being demonstrated is combined loading using compression and torsion. In this position, the gastrocnemius can be assessed to see if it is adhering to the underlying soleus. If it is, shear forces and bending forces can be introduced to decrease the adhesion. The leg is also massaged in the supine position. This is the best position for accessing the quadricep muscles. If, during assessment, areas of edema are identified, lymphatic drain methods can be used. It is important to make sure that the rectus femoris is not adhered to the intermedialis. Effective and intense kneading reduces this tendency. Usually, the vastus lateralis is short. Compressive force with gliding addresses this tendency. If during assessment the firing pattern for knee extension has been found dysfunctional, this would be the appropriate time to treat this condition. The vastus lateralis must not dominate the vastus medialis oblique. By inhibiting the vastus lateralis and encouraging the pulsed contractions producing knee extension, the vastus medialis oblique is encouraged to fire appropriately. By positioning the leg as shown, the inner thigh area can be addressed. The side-lying position is the most efficient way to massage the inner thigh, but if the client is only comfortable in the supine position, this is an alternative. Often, the tendinous attachments of the sartorius, gracilis, and hamstrings become tender and adhered. By positioning the leg as shown, this area can be massaged. Hamstring shortening can be assessed with a straight leg raise or the attachments at the knee by bringing the hip to 90 degrees and then attempting to straighten the leg. If shortening is identified, various muscle energy procedures can be used to assist in lengthening and stretching the area. Whenever performing a stretching maneuver, it is important to stabilize the area to make sure that only the targeted tissues are affected. Combination methods of post-isometric relaxation and reciprocal inhibition combined with stabilizing and stretch effectively treat the hamstrings. While the least efficient of all positions for massage of the hamstrings, the demonstrated position shows that this can be accomplished if necessary. Various forms of rhythmic and dysrhythmic rocking and oscillation help finish the area. If necessary, lymphatic drain can also be used. As previously mentioned, there is a tendency for the rectus femoris to adhere to the underlying soft tissue. If areas of bind are identified, then various forms of shear force, bending force, and torsion force can be introduced to move the rectus femoris off the underlying tissue. When the area is reassessed, more mobility should be identified. If clients are prone to shin splints, by bending the connective tissue in the area, the tendency can be reduced. It's important to mobilize the patella to make sure that there is freedom of movement. If areas of bind are identified, by positioning the leg as shown, the patella can be moved through all available ranges of motion. While not ideal, the calf muscles can be massaged with the client in the supine position.